For the next few sections, 16.4, 0.5, 0.6, we're going to be focusing on the eyes. Going to focus on the structure, the defenses in and around the eyes, and the different infections that we see here. When you look at somebody's eye, what you're actually looking at is the outer layer is what is known as the conjunctiva. Okay? It is a thin membrane-like tissue that covers the eye. So the eye itself, the cornea and all that, is not actually exposed to the environment. There is a thin layer of tissues. These tissues, known as the conjunctiva, excretes different oils, different mucus-containing fluids that all have that not only lubricate, as the slide in the textbook talks about, but will also have, as we see in this lecture, antimicrobial properties in some of the proteins and things that are expressed there. You are constantly making more fluid. The fluid coming from the lacrimal ducts, the lacrimal sac, the ducts, that comes out at the corner of your eye, and every time you blink, think of that as a windshield wiper that goes across the windshield of your car, wiping away the rain. Well, here, your eyelids, every time you blink, not only do they wipe away whatever dust has gotten on your eye since you last blink, but it's also pulling the tear fluid from the different glands, the lacrimal gland, the lacrimal sac, pulling them across the eye. So it's wiping and it's rinsing and then smearing new fluid across the conjunctiva. Within the fluid, what we call the tears from the lacrimal gland and the different, the sac and everywhere. Not only is it going to be, salty, think about it, your tears taste salty. The high salt is going to impede the growth of most bacteria there. But there's also going to be different proteins, enzymes such as lysozyme and lactoferrin, that are going to inhibit bacterial growth. Lysozyme, remember, this is an enzyme that lyses gram-positive cells. Lactoferrin is going to go through and it's going to interfere with the absorption, the taking up of nutrients, so basically starving out the microbes. As you blink, the fluid goes from the outside corner to the inside of the corner of your eye, through the lacrimal sac gland, down through into your sinuses. You never notice it. It's why when you cry, you're shedding tears, making an extreme amount of tears, the fluid, your nose starts to run. Yes, some of it runs down your cheek as tears, but a lot of that fluid, every time you blink and whatnot and have your eyes closed, runs from the outer to the inner corner and then into your sinuses, and you get the runny nose. We want to minimize the immune response to anything associated with the eye. Think about it. You get a cut on your finger. Depending upon how deep, how big that cut is, that area is going to swell up, get warm. The swelling up and getting warm is the inflammatory response, fighting off any microbial invaders. Depending on how severe the cut was, you may have a slight impairment in the function of that finger for a few days, a few weeks. We don't want that happening in the eye. So think about it. You get a cut, you get some bacteria on your eye. It starts to swell up because of the inflammatory response. And it turns out the inflammatory response, we skipped the chapters on the immune system, on the immune response, so bear with me here as I explain it. Not only do you get fluid accumulation, you also get immune cells, immune proteins, and some of the times the inflammatory response can do, in the short term, more damage than the bacterial infection. That cut on your finger that swelled up because of the inflammatory response. Yes, at the cut, those cells were damaged and they die, but there's going to be more cells around that that die too because of the inflammatory response. You don't know it because, well, wound healing, the mitosis of the cells there around the wound, will fill in and everything's good to go. After a few weeks, your finger works just fine. Think about your cornea. Think about the retina, the back of your eye. Any damage around the eye, on the eye itself, that would lead to an inflammatory response would lead to, unnecessary damage to the cornea, further damage to the retina. The cornea is going to have a hard time, repairing itself. That's why people who get, trauma to the eye, their corneas can begin to cloud over. That's scarring of the cornea. The retina, once damaged, does not repair. So we want to minimize. So our eyes have what is referred to as immune privilege. Okay? We're not going to have an inflammatory response inside the eye. You might get an inflammatory response in the eye socket itself. You get an infection, you'll see people have styes, the swelling of their lower eyelid or something like that. That's an inflammatory response to the skin and the mucous membranes lining the eye socket. But the eye itself, the eyeball itself, minimal to no inflammatory response. For just that reason, we do not want to risk scarring or indirect damage due to an over immune response.